Hello, my name is Melody Pride, and tonight I am going to talk about treatment for opiate addiction. And at the end of my speech, I hope my audience will ponder why we still send drug addicts to prison instead of to rehab where they truly belong. Imagine you're involved in an auto accident, and on the way to the hospital, you have a serious injury, and on the way to the hospital, the paramedics give you a strong pain medication like morphine. When you get to the hospital, it's determined you're going to need back surgery, and after surgery, during your recovery period in the hospital, the doctor prescribes these same strong morphine or maybe Oxycontin medication. And after a couple of weeks of treatment in the hospital, you're sent home with a prescription with Oxycontin. And when you go back for your checkup, the doctor says, okay, you've recovered enough, I'm going to stop giving you the pain medication. Now, the doctor has to know that by now you're addicted to it, because most people know that at this point. So the doctor goes ahead and takes these away from you and says, you're on your own. He provides no help or support. Well, opiates are highly addictive. They are found in several widely used drugs, and by this time, your brain chemistry has changed, and you need these drugs. You can't just get over it on your own. The chronic use of opiate actually changes your brain. It attaches to your brain receptors, and your brain needs it, and you become addicted to them, and you're in denial that you are addicted to them, or denial that you've lost control of it, and you're at a loss of what to do. Well, at this point, there is a treatment out there, and at this time, the best treatment available is a drug called Suboxone. It's difficult to get Suboxone because at this time, doctors have to be trained to prescribe it, and each doctor can only give you have 100 patients at a time that he prescribes Suboxone to. In 2000, the Drug Addiction Treatment Act data was enacted and allowed qualifying doctors to prescribe opiate medications such as Suboxone to treat addiction. This caps the number of patients that doctors can treat to 30 for the first year after completing certification, and 100 thereafter. This is by Schoen. There are also requirements imposed by insurance companies that require patients to attend counseling. Combined with counseling and the price of Suboxone, the cost is prohibitive to most people. At this point, according to Saltz and Dahlman, over 21 million people in the United States have substance abuse disorders. And most of these addictions these addicts do not get the treatment that they need. The few that are fortunate enough to get this treatment, less than 7% get it through their doctors. What happens is they end up on the streets, and they end up taking street drugs such as heroin or fentanyl, which they will end up either getting arrested or overdosing. And if they get arrested, they're just thrown in jail for a certain amount of time and left to withdrawal on their own. And the withdrawals are, I've heard, absolutely horrendous. And then they're put back out on the street with no treatment still whatsoever, and they go right back to using these street drugs until they get arrested again or until they overdose and die. Instead of doing this, why can't doctors, primary care physicians, just prescribe this Suboxone to people? Because there is another disease that is a chronic disease, and it's an epidemic in America, that is caused by our lifestyle. And when you're diagnosed with this disease, you basically go to the doctor. He tells you have it, tells you maybe you need to change your lifestyle, but at the same time prescribes meds and says you'll probably be on this medication for the rest of your life. This disease is called diabetes, and nobody ever tells a diabetic, you just got to deal with it on your own. The type 2 diabetes, you just got to deal with it on your own. We're not going to give you any medication until you prove that you can live the right kind of lifestyle. That is the standard treatment that we need to use for people that are addicted to these drugs. This drug use has become an epidemic in America, with over 64 million people a year dying from this easily treated epidemic. We need to change the way we think about drug addiction. The notion that these narcotics, that these Suboxone are narcotics that prevent people from doing intensive therapy when used properly is ridiculous. The converse is actually true, according to Dr. Mark Willingberg. If someone is treated with Suboxone and then uses opium, such as heroin, they don't get the same euphoric feelings. They don't get any good feelings, according to Fletcher in 2015. So in conclusion, I think it's time to stop being so judgmental against people with this unfortunate disease and treat them like any other human being. Punishing them for hurting themselves is obviously not working, so why not try to help them instead? Putting addicts in jail is exasperating the problem, so why not put them in treatment instead? This government has spent 40 years fighting a war on drugs, and they've never won a single battle in that war on drugs. Let's get these people into treatment where they belong. Maybe we can contact our senators, our representatives, our congresspeople, and tell them, let's treat these people like human beings. They are not to be thrown on the side of the street. Stop the war on drugs and start the treatment on drugs. Thank you. Good night.